your modeling tell you insofar as the projections for illnesses or deaths between now and the end of the year? And is the state's hospitals capable of handling any increase?
Similar to what we saw in the dashboard that was relayed today, the numbers for hospitalizations is well below the cutoff for concern. We're working closely with the hospitals and feel that they have the capacity. So from our projections standpoint, we're staying vigilant, but are confident that our hospitals have what they need to respond going forward.
And as far, I'm sorry.
Our projections overall, prior to the cases that the governor discussed that we've seen from our colleges and universities, had continued to remain in a plateau and a strong low level. So our focus right now is getting our handle on what we're seeing with colleges and universities, working with the administrations to be as responsive as they are and as aggressive as they can be in getting those cases contained, testing, and getting those numbers down so that we can return to the types of projections that we had previously.
If I may follow up, short of inoculation, you don't see, or a vaccine, you don't see a significant decline in the rate of illnesses or deaths?
Our goal is to see a significant decline and to do all of the steps that we need to, like masking and distancing. Time will tell. We'll continue to follow the data.
What factors are there beyond the level of testing that and the college outbreaks that contribute to Rhode Island having the high per capita new cases?
What was described are the primary factors, seeing the increases in cases, that bump, and the difference in those cases adds more to where we were at the baseline last week. So that is the primary contributor at this time.
Are there others?
The usual components that go into where we were previously, the isolated cases occurring throughout the communities, all of which reinforces the importance of everyone continuing to mask, everyone continuing to watch their distance and stay vigilant.
Governor, give question, Doctor.
I'm sorry, Carl, can you repeat your question?
Yeah. The question was, are there other factors for Rhode Island that had us somewhat above our neighbors in the per capita cases beyond the level of testing and the college outbreaks?
Thank you for repeating that. So the colleges, what we're seeing there are the key. We are testing the most. We have a densely populated state, and we are testing more in our densely populated communities, which were the same factors that were contributing previously. So there isn't any additional difference beyond what's been shared with the colleges and universities.
Yeah, but if you had almost 200 cases associated with 2 colleges, that's the answer.
Brian. Governor, given what you said that college kids will be college kids when returning to campus, should something have been done proactively ahead of kids coming back? And I know a lot of this is off-campus housing, Greek houses at URI. So was there mistakes made there, and can anything be done moving forward to act preemptively other than school suspensions or discipline when it comes to these kids?
Yeah, so it's a great question. I would say this, you know, hindsight is 20/20, and I'm sure the administrators at PC are asking themselves that exact question: what should have we done? I think we knew, like, look, problems of partying on Eaton Street are not a new thing. We saw this at PC in the spring when this happened. So I would have liked it if the college had done more proactively. We knew this was going to be a problem. Having said that, we are where we are now. They are cooperating with the Department of Health. I think they've gotten religion on the topic, and we're going to work with them. But what I would say this, and I've said this to every college president, You must hold the students accountable for their off-campus behavior. There has to be real on-campus consequences for what the students do, even when they're off campus. And we've been crystal clear about that. You know, we thought about not allowing the college students to come back to campus. We thought about requiring them all to do what Brown did, which was, you know, start in October. And we chose not to do that, largely because we had these discussions with the college presidents and their teams, and we said to them, are you going to be able to control the behavior of your students off campus, in bars, in off-campus housing? And they all said they could, and they all said that they would take precautions to make that happen. By the way, they all did, but obviously it wasn't enough. So we're learning. You know, we're learning, and we have to continue to do more.
And just to follow up, and I know you said obviously there's consequences beyond the schools with the travel restrictions and affecting all Rhode Islanders, but maybe Dr. Alexander Scott has some information. Are any of these kids, whether it's the college students or grade school kids, been hospitalized? Are there any significant, I guess people might say, how sick are these kids?
There are no associated hospitalizations at this time with our institutes of higher ed cases that we know of.
K to 12?
K to 12 as well.
Governor, in regards to Providence College, do you agree with the Providence lawmakers who are calling on PC to go full remote learning for the remaining of the year?
I'm not there yet. I'm not there yet. This is an unfortunate situation, and the college didn't have the systems in place adequately ahead of time to prevent it. So they're doing a good job now, PC is, and they're enforcing the stay-at-home order. I think this is preventable going forward. I mean, there's not that many homes on Eaton Street. They've hopefully learned their lesson. The school has to do better monitoring, better enforcement. So I think no. Anyway, my short answer is not at this time. If this continues, absolutely.
Another question in regards to K through 12. We're getting some concerns from parents with buses and windows having to be open as we get to the colder months. They say that it's not healthy. Do you plan on updating that guidance as we get into the colder months?
We'll deal, like everything, we'll deal with it when we get there.
So,
But I think they'll probably have to keep the windows open, though.
yeah, Governor, that was my question. I heard from a father of kids in Exeter. They're on the bus for 45 minutes. Now, you know how cold it was Monday, Tuesday, and he said, I mean, it just throws them off for the entire day just getting there. You know, you're in a park in September, and so I appreciate the push for fresh air. But you know, you're creating the playbook on this. At what point do you decide to rewrite it a little bit? At what point do you have enough body of evidence to say common sense would dictate that maybe we don't need to have every window open for 45 minutes in December?
Exactly. So you just answered your own question. So I would encourage you guys, members of the press, to go to this new website, the new tool, the health.ri.gov/airflow. You could do the math, and you can actually figure out how many windows have to be open in order to have enough air circulation in a bus. I cannot tell you as I stand here how many that is. But again, I would just say this. We're living in a highly imperfect world. I understand the kids will get cold, potentially. It's better than not going to school and better than getting COVID. And I am hopeful that by the winter, we might have a vaccine or better therapies. So I'm not going to today make any proclamations about what we're going to do in December. But I think the short answer is what you said. Not every window has to be open the whole time.
Right. And, you know, I didn't major in math either, but his question was, has anybody from the Department of Education or the Department of Health ridden on a bus? Has any one of your staff actually gone, not just this last couple of days, but are you going to go on the bus and sit there and see what it's like for the kids? Commissioner, you talk about all the time about getting our kids ready and everything else. Has anybody from RIDE ridden a bus with all the windows open?
We have been on the bus, so we have staff that has done that, and we will continue to do that. But as the temperature changes, and the other thing that we have done is that we're in contact with other states that have had very low incidence, that have different procedures and protocols than we have. I think I talked about it before. We've been in contact with Indiana, who has had very small cases, and they have different bus procedures. So we're also learning from other states that have gone before us on what their busing is. So we're looking into it. So this is not something that we're not taking into account.
And just one follow-up, Dr. Alexander Scott. There was a big hoo-ha last week about silent lunches and kids not being able to talk. And somebody had looked at a professor from out of state. What does the health department have to say about that? Because a lot of elementary schools have adopted this now. The kids, if they're sitting there, and you can imagine, you've had your own kids that, I mean, telling them to be silent either on the bus or at school, it's just, it seems untenable and it seems a little draconian.
What we have said is put together the measures that work to increase compliance for children to wear masks during the day. It's a lot to be able to wear masks throughout the course of the entire day for students. And so there are a variety of approaches that schools can take to help increase that compliance by allowing for structured times when they can take their mask off, whether it's a certain time during the day, during lunch, going outside, as long as people are appropriately distanced. We've also shared that if those breaks are built in the ways that the school determines, the risks for COVID transmission are decreased if there is less talking during that time.
Right, but adults who go to a restaurant, you don't expect them to sit and either not talk to each other or not take off their masks to eat. So why, at a restaurant, why wouldn't that apply to kids who, as we know, are not as likely to get or transmit COVID? It doesn't seem to make any sense.
There are a variety of approaches schools can take. If that is one of them, and that's a way to increase compliance, that's something we have considered acceptable, as long as they are allowing for other ways for the students to be able to engage. We know how important it is to be together in person, and there are other approaches that can be taken as well.
Governor, last Wednesday, you announced that there'd be $1 million available for businesses to be outside. What was the reaction to that? Can you give us an update?
The reaction's been very positive. A lot of small businesses, especially restaurants, have reached out and said, great idea, because I need heat lamps, and they're expensive and hard to find. So I'm sorry, I'd have to get you the details of exactly where that is in terms of have they started with the applications. But I know there's a lot of interest. Like yeah, absolutely. There's a lot of interest.
More than 80 have applied.
More than 80?
Okay, good.
More than 80. Is it at the 1 million, or is there still money? Is there, if it's been that positive?
I'm very open to doing more. If it's a success,
Yep.
and if it helps businesses stay open longer, I'll figure out a way to expand it.
To get more money into that.
Yeah.
And just,
yeah.
I want to clarify, with all the outbreaks of the colleges, that said, plus K through 12, but none of those students are in intensive care on
Correct.
respirators. So knowing that, and it seems different than what we thought of the virus back in the spring when all the schools shut down, with that being that way, is there any reason why students shouldn't be back in Rhode Island for in-person learning?
I don't think so, and I maintain that position. I just last night, the Warwick School Committee, for a minute, they were going to do the right thing and let the kids go back to school, and then they chose not to last night. Pawtucket, I don't see any reason why they're not back in school. So we're going to keep pushing them. And that's why I set up this command center. It's a command center because I know they're worried. They don't know how to do it. I understand that. So call us. Let us help you. It's possible. The children deserve it, and the kids are going to suffer more. Like, to your point about risk, I understand there's a risk that people will get sick.
Right.
There's a guarantee that they're going to fall behind, suffer mental illness, be out of sorts if they don't go to school.
And especially the special needs kids who,
It's
I mean,
terrible.
that's impossible for them
It's
to learn.
very tough. Multi-language learners, poor kids. He's been waiting for a while.
For the doctor, I'm sorry? Last year, Mike, thank you. Doctor, looking at the group of people under 30 who have been diagnosed positive and tested, and that would include the colleges and the K-12 system. Is there any increased risk of transmission because a larger number than otherwise in other age cohorts are asymptomatic or very mildly symptomatic to the point where they don't know they're infected? And if so, has the Department of Health tried to measure the extent of that? You know, what percentage of people continue to socialize, even in limited ways, not knowing that they're infected and capable of transmitting the virus to others? Because, I mean, CDC doesn't really know how many people are asymptomatic. The latest guidance from them could be as low as 10%, it could be as high as 70%, so they pick the number and they figure it's about 40%. Has DOH measured that? And when people have tested positive, do you know whether they've been symptomatic or not?
Absolutely. We do. We track very closely what proportion of our cases are asymptomatic versus our cases that have symptoms. Still with our institutes of higher ed, more of the cases did not have symptoms compared to those who do. It's further evidence for why we have to be vigilant about messaging, regardless of how you feel. You need to wear your mask. You need to keep your distance. You need to keep your groups small, and you need to keep them stable, particularly among people who otherwise feel healthy and feel fine.
What is the percentage of people who've tested positive in that under 30 cadre who are asymptomatic or mildly symptomatic to the point where they don't know that they're infected?
I'll get back to you with the exact number.
And also, the governor talked about the red lines on the chart. If we start to approach those red lines on any one of those three graphs, what types of public health measures would be necessary, other than very coarse things like rolling back to a prior phase, that you feel would be indicated to try to combat that increase?
That's something that we are always in discussion on. It would be driven by the types of cases that we are seeing to help inform which interventions would give us the highest yield, the most targeted intervention, which is always what our approach is. Examples of that include how we are assessing people in the work setting who are going to work sick. If those numbers were to increase or to continue, what are additional changes that we would need to do in a work setting to help address that? Similar to what we're doing with Providence College, there's a stay-at-home directive specific to Providence College. We're repeating the second round of full student body, the whole student population being tested this week, and continuing to take the aggressive steps we need to bring it under control. The governor has always mentioned being pinpointed and targeted. Our comprehensive testing and case investigation and contact tracing system allows us to continue that going forward.
Tanya, last question.
Tanya Signori from the Rhode Island Echo to the governor. Regarding hospitals and regarding nursing homes, are we still, I'm not sure why there's still not a separate wing going on in hospitals and in nursing homes. There's still some that don't have a separate wing. And the governor can answer as well. I just didn't think there'd be mixing of patients, mixing of COVID patients with regular patients, whether it be 2 doors down, 1 door down. I understand there's different pressure systems and things like that, different precautions for the COVID patient. But being right next door and you're a regular patient at the hospital to a COVID patient is can be a little scary. I didn't think that was going on this many months into the virus. There's a way that can be changed and all, patients that are COVID be put in one wing in a hospital and in a nursing home. Even better, can we start using the field hospitals, and anyone who's positive can go into a field hospital and just stay out of the hospital environment, out of the nursing homes. Just an idea for you and your team. And how to get around, there's also some mixing of staff where that staff member is going to the COVID patient and going next door to the regular patient. Now the regular patient needs a COVID test. Like, some of this is going on still. So is there a solution?
So thank you for that question. I'll take it one facility type at a time. In our hospital setting, the personal protective equipment that exists fulfills the approach that you are asking of helping to separate out patients who have COVID from patients who do not have COVID. So ensuring that our healthcare staff have the PPE that they need, as well as the isolation precautions that are in place for each individual patient, allows us to achieve the type of cohorting approach that you're asking about, which is fundamental to our public health response. In the nursing home setting, where personal protective equipment is also used, we do apply even more so the cohorting approach, where individuals are brought together into a particular wing, and that's more so because residents are there for a longer period of time, and it gives us that ability to be able to do that. So our infection control practices are in place regardless of the hospital or the nursing home setting. And our hospitals right now have the capacity they need in their current environment to provide the excellent care for patients, whether they have COVID or not.
Brian, one more, then we're done.
Governor, following up on Anita's very important question to a lot of kids last week about Halloween, which got a lot of traction. Since you said it should go on, the CDC has said traditional trick-or-treating is higher risk. It appeared last week you hadn't given it much thought. Have you given it more, and how much input do you think the state should have as opposed to towns on trick-or-treating?
Yeah.
And are you ready to say that kids should not do door-to-door trick-or-treating?
Oh. Okay, so the other day my own son said, "So Mom, what are we doing for Halloween?" So I get it. And I said, "I'm not sure yet." And he said, "Well, you better hurry up and figure it out." So I'm on it. I don't have an answer yet. We might argue about this. I'm going to let her answer in a minute. I want the kids to do some trick-or-treating. So we're trying to figure out, just like everything else, I want the show to go on, but we have to figure out a way to do it safely. So believe it or not, this is a subject of great discussion. I saw the CDC came out. That makes it a little harder. I want to get creative and have a fun Halloween and see what might be possible.
So we are actually working on detailed guidance that will provide specific to Halloween, and we actually agree that there is a need to support kids in participating in some of the activities that they participate in, while understanding the aspects of it that will be done differently. So we're just going to focus on the same principles that we have been sharing throughout this response and have it apply to Halloween. People will need to know they should stay at home if they're sick, and ask others to do the same if they have any symptoms. It's helpful to do any trick-or-treating outside, more so than staying indoors. Can also stay 6 feet apart during that process, particularly with people not from the same household, and come up with ways to have a no contact approach. You can easily leave treats in a bowl, on the porch or in a set location for children to be able to engage in, as long as there is adult supervision and masks are worn. So we will work together on ways to make it happen safely.